Let's talk honestly about painful periods. The kind that has you curling up with a hot water bottle, cancelling plans, or counting down the hours until you can take your next painkiller. If you've ever wondered, is this normal, or do I just have to put up with this? You're in the right place. In this video, I'll walk you through what's typical, what isn't, when to self-manage safely, when it's time to see your GP, and when you should seek urgent or emergency care. Based on UK guidance, we'll keep it clear, practical, and compassionate, so you know exactly what to do next. Welcome to Balanced Woman UK, where we provide evidence-based women's health information you can trust. Everything in this video is based on official NHS, Royal College of Obstetricians and Gynecologists, and NICE guidance. And I've linked all sources in the description below. Here's what we'll cover today. We'll explain common causes of period pain: primary dysmenorrhea, endometriosis, adenomyosis, fibroids, pelvic inflammatory disease, and IUD-related cramps. We'll look at evidence-based treatments that actually help: NSAIDs, heat therapy, hormonal options, and practical lifestyle supports. We'll bust a few myths, and we'll give you a step-by-step plan to help you decide whether to adjust your self-care, book a GP appointment, or call for urgent advice. A simple truth to start: period pain is common, but you do not need to suffer in silence. If pain is interfering with your life, your work, your studies, your sleep, or your relationships, that's a perfectly valid reason to seek help. You deserve to feel better. There are options. What counts as normal period pain? Period pain, also called dysmenorrhea, is very common. The most typical type is primary dysmenorrhea. That's pain driven by prostaglandins, chemicals released by the womb lining during menstruation. Prostaglandins make the uterus contract to shed the lining. For many, those contractions feel like cramping in the lower abdomen, sometimes radiating to the lower back or thighs. You might also get nausea, loose stools, or a general under-the-weather feeling in the first day or two. Typical features of primary dysmenorrhea include pain starting just before or at the onset of bleeding, pain worst in the first day or two of the period, symptoms easing as the flow lightens, good response to over-the-counter pain relief like ibuprofen or naproxen when taken correctly, and to heat therapy. If that sounds like your pattern and your pain is manageable with simple measures, that's reassuring. It's still valid to seek better relief if you need it. However, some patterns suggest you should see your GP. Pain that begins earlier in the cycle and stays severe through the period. Pain that is progressively worsening over time. Pain with sex, pain when opening your bowels or passing urine, or pain that's focused to one side. Heavy periods, irregular bleeding, or bleeding between periods. Pain that disrupts your life month after month despite using standard pain relief correctly. You do not need to diagnose yourself, that's your clinician's role. But understanding common causes can help you describe your symptoms and advocate for effective care. Quick myth buster: period pain is just part of life, get on with it. Not true. Severe, life-limiting pain is not something you should have to tough out. Effective treatments exist, and your GP can help you access them. If over-the-counter painkillers don't work, nothing will. Not true. The timing and type of pain relief matter, and hormonal options can make a major difference. There are multiple pathways to try. If you have endometriosis or fibroids, surgery is inevitable. Not necessarily. Many people manage symptoms with medication and non-surgical options. Surgery is one option among several, and depends on your situation and preferences. Now let's explain some common causes of painful periods. First, primary dysmenorrhea. This is the most common cause of period pain in otherwise healthy people who menstruate. It's driven by prostaglandins causing uterine muscle contractions. It often improves with NSAIDs, ibuprofen or naproxen, taken at the right time, heat therapy, hot water bottle or heat pad, hormonal contraception, which reduces prostaglandin production and can thin the lining, adjuncts like gentle movement and TENS. More on these shortly. Number 2. Endometriosis. Endometriosis is when tissue similar to the womb lining grows outside the uterus, on the ovaries, fallopian tubes, or elsewhere in the pelvis. It can cause severe period pain that may begin before bleeding starts, pain during or after sex, pain when passing urine or stool, particularly around your period. heavy periods or bleeding between periods, fertility difficulties in some cases. Pain severity doesn't always match the amount of endometriosis seen. Some with mild disease have severe pain, some with extensive disease have milder symptoms. If your pain is cyclical, worsening, and affects daily life, speak to your GP. They can assess and refer to gynecology if needed, in line with NICE guidance on endometriosis. Number 3. Adenomyosis. Adenomyosis occurs when tissue similar to the lining of the womb grows into the muscular wall of the uterus. Possible symptoms include heavy, painful periods, a dragging pelvic ache or pressure feeling, periods that seem to be getting worse over time. Adenomyosis can respond to hormonal treatments and pain relief. Diagnosis may involve ultrasound or sometimes MRI. Your GP can advise on next steps and refer where appropriate. Number 4. Fibroids. Fibroids are non-cancerous growths in or around the uterus. They can cause heavy periods, sometimes very heavy, cramping and pelvic pressure, back pain, or pain during sex. Management ranges from medication to procedures that shrink or remove fibroids, depending on size, symptoms, and your fertility plans. Number 5. Pelvic inflammatory disease, also known as PID. PID is an infection of the reproductive organs. It's often due to untreated sexually transmitted infections, but not always. Symptoms may include lower abdominal or pelvic pain that can worsen with sex, abnormal vaginal discharge, fever or feeling generally unwell, bleeding between periods or after sex. PID needs prompt treatment, usually antibiotics, to prevent complications, including fertility problems. If you suspect an infection, don't wait. Contact your GP or a sexual health clinic promptly. Number 6. IUD-related cramps. Hormonal IUDs, levonorgestrel intrauterine systems, often improve period pain and reduce bleeding over time. Copper IUDs can cause heavier bleeding and stronger cramps, especially in the first few months after insertion. New, severe, or persistent pain after insertion should be checked to rule out malposition or other issues. Other contributors to consider. Ovarian cysts can cause pelvic pain, sometimes sharp or one-sided. Irritable bowel syndrome and bladder conditions can coexist with period pain and amplify discomfort. PMDD, premenstrual dysphoric disorder, is primarily about severe mood changes in the premenstrual phase, improving when bleeding starts. While PMDD is different from dysmenorrhea, mood symptoms and pain can interact. The NHS has a helpful overview of PMDD that's worth knowing if premenstrual mood changes are a major issue. We have made a video about that recently. I will leave you a link in the description and pin it in the comment section as well. Here are some red flags you should never ignore. Call 999 or go to A&E immediately if you have sudden, severe lower abdominal pain with feeling faint, fever, vomiting or collapse. Symptoms suggesting ectopic pregnancy. Severe one-sided pelvic pain, shoulder tip pain, dizziness or collapse, especially if there's any chance you could be pregnant. Very heavy bleeding soaking through pads or tampons every hour for more than 2 hours, or passing large clots with signs of faintness or feeling unwell. Severe pelvic pain with high fever or signs of sepsis, such as shivering, confusion or rapid breathing. Contact NHS 111 urgently if you have severe pain that's new and unexplained, pain with fever or unusual vaginal discharge, severe or worsening pain after a procedure or after IUD insertion. You're unsure whether your symptoms can wait for a routine GP appointment. Book a GP appointment soon if you have period pain that stops you working, studying or sleeping, pain getting worse over time or changing in pattern, pain with sex, pain on opening your bowels or pain when passing urine, kidney or heart problems, or you're on anticoagulants. If NSAIDs aren't suitable, paracetamol is a safer alternative but may be less effective for cramping. Heat therapy. A hot water bottle or heat pad on the lower abdomen can be very effective, sometimes comparable to NSAIDs for some people. Use a cover and avoid burns. Gentle movement. Light exercise, stretching, or a short walk can improve blood flow and release endorphins. You do not need to do anything intense, just move in a way that feels kind. Transcutaneous electrical nerve stimulation, TENS. a small device that delivers gentle electrical pulses via skin electrodes. Many find it helpful for period cramps, and it's safe when used as directed. Hydration and regular meals. Keeping blood sugar steady and staying hydrated can help with energy and nausea. There's no single anti-cramp diet, but balanced meals support your body. Sleep and stress support. Good sleep habits and relaxation techniques can lower pain perception. This never means your pain is in your head. It means stress can turn up the body's pain volume, and lowering stress can turn it down. Track your cycle and symptoms. Note pain timing, intensity, what helps, bleeding pattern and associated symptoms, bowel, bladder, sex, mood. A simple diary or app is fine. This record is extremely helpful at your GP appointment. Self-care is not a hurdle you must clear before seeking medical help. It's one part of your plan. If you've tried the above and your pain still disrupts your life, book that appointment. What to expect at the GP and how to advocate for yourself. A typical GP appointment may include history, when pain occurs in your cycle, what it feels like, what helps, whether you have pain with sex or on opening your bowels or passing urine, your menstrual pattern, contraception, pregnancy plans, and family history of related conditions. Examination. Depending on symptoms, your GP may examine your abdomen or do a pelvic examination. Consent is essential. If you're not comfortable, say so. You can have a chaperone, request a different position, or discuss alternatives and timing. Tests. Your GP may suggest STI tests if an infection is possible. Blood tests if heavy bleeding raises concern for anemia, or an ultrasound if fibroids, ovarian cysts, or adenomyosis are suspected. Treatment trial. For suspected primary dysmenorrhea or endometriosis, first-line options commonly include a timed NSAID regimen and/or hormonal treatments, such as the combined pill, a progestogen-only pill, or a levonorgestrel IUS hormonal coil. Referral. If symptoms suggest endometriosis, adenomyosis, significant fibroids, or if initial treatments don't help, you may be referred to gynecology for further assessment and management. How to advocate for yourself. Bring your symptom diary with pain scores, days affected, and what you've tried. Be specific about impact. I miss 2 days of work each month, or I can't sleep on day 1 and 2. Mention family history of endometriosis or fibroids. Ask, what's the most likely cause, and if this first treatment doesn't help, what's our next step? If pelvic examinations are difficult for you, say so. Preferences and consent matter. You can plan for a later date, use a chaperone, or explore alternatives first. This is a partnership. You bring your lived experience and priorities. Your GP brings clinical expertise. Together, you can find a plan that fits your life. If a treatment doesn't help after a proper trial, for example around 3 cycles unless your GP advises differently, ask about alternatives or referral to gynecology. That's standard care. If any of this felt familiar, I hope you feel seen, and more importantly, equipped. Your next step might be as simple as changing when you take your pain relief, or it might be finally booking that GP appointment you've been putting off. Either way, you're not overreacting. You're taking care of yourself, and that matters. As we have discussed the importance of keeping a diary and dates to benefit your GP appointment, watch this video next on how your period really works to fully grasp the needed understanding to communicate effectively with your doctor.